Over the past year, you said it was hard for you, your family. You were quite vocal about your own mental health needs. You took a week off, if I'm not mistaken, for your, own mental health during the past year. What are some of those lessons that you've learned that you can offer to other leaders and others in healthcare or anywhere else?
I am sure that I'm not the only one whose mental and physical health has been impacted by COVID-19 this year. Everyone has been affected by this. And one of the most significant ones for us working in healthcare has been moral injury and moral distress. That feeling of, sometimes it's called epistemic injustice, that feeling of just not being heard or understood. And the inability to kind of stop injustices from happening when they're happening in front of your eyes. And for me, that was a real challenge, sort of, being at some tables, trying to raise my voice as much as I could and not seeing the results. Even when the data was clear, the voices were clear, everything, was according to the textbook definitions, everything was in place to make the right kinds of choices. And then they didn't happen. I'm an optimist at heart. And so even though I am not naive and have lots of experience with this, I found it really, really ethically troubling to go through that experience. And it also, I think, coupled with the burnout of very heavy workload during COVID that many of us had, and that kind of rush of adrenaline that had us going at the beginning, ebbing away. For me, it just sort of culminated in, I need to step back from that. Because it also, the other piece of it was that overinflated sense of self-importance that, if I'm not doing this, everything's going to fall apart. And that is not true. We are doing this collectively, and every single one of us needs to be reminded of that message that we're really on. I mean, it's important for us to be there, but not any one single one of us. If our structure is designed in a way that requires just one of us to be there, we're doing it wrong. So I needed to be reminded of that it was okay for me to step back, that other people would and could step in. That of course I'm not the most important, not even close to the most important part of this. But you get caught up in some of that feeling of burnout that what you're doing is overinflated in your own sense of importance. So I needed to step back from all of that. And at the same time, having kids who are struggling with online school, winter weather, all the factors coming together. And so the best thing I could have done was to just take some time to recover and rest and follow my own advice about social prescribing and the kinds of things that we need to do to reconnect with ourselves and our communities. So it was really the best thing I could have done. It was a hard decision at the time, but looking back, it's a no-brainer. And it helped me think about kind of other places I could start putting my energy where I wouldn't feel that same sense, which is one of the reasons I'm working at the federal level now, trying to find new avenues and new opportunities to keep this work going. And so, I really recommend that to everyone, that we lean on our communities and that we remember have some humility about our work. Remember that it's okay to do that, to step back.
How did you reconnect to yourself? How do you do it currently? And who do you go for support?
I engaged in therapy. That helped. I spent lots more time outdoors in nature, which is for me probably the number one thing. I tried to spend time delighting in my children instead of seeing them as intrusions on my work. I just spent time with my family and community, and I just tried to unplug from things like social media that can feel like totalizing in your life. So, nothing groundbreaking, just the things that we all know are healthy and important that can easily go by the wayside. So really trying to do that self-care thing, to prioritize that as a way. You can't care for others if you're not caring for yourself, and I needed to be reminded of that.
I love how you said, you seeked therapy, because there's still such a stigma around therapy sometimes.
Yes. Well, for me, having someone to talk to was absolutely essential. And I was amazed that I had never done that before in my life. And it's just been such an important part for me of getting through this crisis. Is to just have, someone who has training and expertise just to talk to and connect with, and to just know someone's in my corner who's not going to be judging anything about what I'm doing, but going to help me find strategies to be healthy physically, mentally, socially, and so on.
Right.
So I highly recommend it.
Are you still continuing with it, or was it for a short period of time?
I actually just completed it because I've been feeling so well lately, but we've kind of, I imagine I'll be re-engaging at different points throughout my life whenever I need it. And even just finding that time, finding an hour in your week or month or day to do something like an hour of therapy. I mean, that can seem really hard when you're very busy too. And so, for me, it was one of the first steps toward recognizing that I had the power to change my calendar and put in things that kept me safe and healthy and alive and on the way to wellness.
When you look back, Kate, what would you say has been your biggest either leadership failure or a mistake or a learning opportunity that you've had?
It is that lack of self-care. I think that has been the most important one, in trying to balance this non-linear career path and multiple different job responsibilities, and that feeling of really wanting to see change in the world with also parenting 3 young kids who really need me, and who I really need too. And recognizing that and really starting to prioritize that. I'd say it's something I'm still working on. I'm still not that great at. It'll probably always be a challenge for me, but it's something that I'm recognizing I can't live without. And so it just has to be part of life. And, seeing as my research supports that, I really have no excuse but to follow that advice and, stay connected to community and do all the things that my own research and work show are important for our well-being, and that I'm included in that. And of course I am. So I think for other people that you're going to find your own challenges, but self-care is just so critical. And self-care for me includes community care and, getting the care you need from formal and informal sources all around you so that you can keep being you and enjoying your life as much as you can, and that it's okay to find joy even in moments of pandemic and inequity, because that's what you need to keep doing this work.
Mm-hmm, mm-hmm. And for you to start giving importance to self-care, did you have to hit a low point in order to realize that this was important? Or
Yeah, I did. It's embarrassing for me to say that because I was talking the talk for a long time. And I'm on the radio in the first weeks of the pandemic telling people to do all the things and not doing them. So really, really not following through on the kinds of things that I was saying were important about, disconnecting from electronics and connecting with people and whatever, all the things are that we know are important for self-care. And I over time started being stripped of all those things and over investing in the work and also the well-being of my own team, and other people who are facing their own challenges and struggles in a time, not just of pandemic, but also Black Lives Matter movement, major inequities, like big challenges that people were dealing with in their own lives that I was trying to help support as well as a manager. And so it became very encompassing, and it felt like a lot of responsibility over time. So again, for people to, if you can step back from that a little bit and get some perspective, it can really help you move forward in a way that's healthy for everybody.
Yeah, sometimes it's hard when you're in it, right? It's almost like you need to step out and look at the big
picture. So probably doesn't necessarily have to take a low point, but it does need, some kind of distance to get a good sight on that. And I know there are people working extremely hard right now, particularly those working right in healthcare, who don't have that option or feel they don't have that option, and other essential workers too. And so, we want to make sure that opportunity becomes available to these people as soon as possible so that we can avoid the negative health outcomes that come from this kind of overwork. And, even just too many hours of work. There was a World Health Organization study that came out today showing that it contributes to hundreds of thousands of deaths worldwide. We need to change that. We need to look at our own cultures of overwork and think about how we can change that in the near future. If we can go in reminding ourselves that it's kind of our obligation to take care of ourselves, just like it's our obligation to take up space when we can. For me, that makes it easier. If I feel like it's my duty somehow and not an indulgence, then right. I'm more willing to do it. And I don't know that if that helps anybody out there, I would encourage you to think about it in that way too.
Yeah, that's great advice, because leadership is really selfless. True leadership is about service to others.
Yeah. So I think it can be hard to think about taking care of yourself. It feels like taking away from that mission, but it really isn't. It's in the service of that broader mission.